Hello there and welcome to episode 152 of Chairside Live. We've got a great show for you today, but before we get into that, let's check in with Dr. Abai. Dr. Abai, how you doing today?
I'm doing great, Megan. How you doing?
Good. Did you get a full night's rest last night?
I kind of did, actually.
Okay.
But
nice.
I was thinking about what we were going to talk about today, and we have BruxZir Anterior. It's one of the newer products, and we've done a lot of cases with it. We've developed it quite a bit, and there's been a transition in the dental field. Obviously from PFMs, but even going further back from that, when we were first using porcelain on top of a metal type of substructure, it was essentially CapTech, but back in the day they were using gold foil and they were pressing ceramic on top of that. So there's been a big transition from the softer material into the BruxZir material. And obviously when we first started using BruxZir, it wasn't as aesthetic as it is now. And now we're using it more in the anterior, and we're getting great results with it.
Nice.
Why don't we go ahead and take a look at the case of the week. Okay, so let's go over the case of the week for this week, and I want to present a case that was actually completed by Dr. Anna Maria Mirsan. She is one of our in-house dentists, and she's also a certified dental technician, so an extremely talented individual. And this case, this patient presented for the need to have 4 anterior crowns replaced, 7 through 10. So Dr. Mirsan, after getting the patient numb, went ahead and removed the old crowns. And now she's prepping the margins and making sure that any recurrent decay is cleaned up from around the margins of these teeth. Obviously, you want to go through and make sure that you clean everything up after removal of the old crowns, and certainly there was some leakage around these where they had to be removed. This technique, in terms of the crown preparation, is the reverse technique. I like it because it gives you a set of burrs to go through in order to get a final prep. It gives you certain guidelines, so it's very helpful. Clinicians have their own technique, and obviously if you're comfortable with the way you're prepping teeth and you're doing it right, that's based on your comfort level. So again, the reverse prep technique works quite well, and we like it because it's a standardized way of prepping the teeth. So once the teeth are prepared, the laboratory actually has fabricated a tooth prep guide that you can seat on top of the preps to make sure that you have enough reduction. Now for the topic of our discussion, we're talking about BruxZir Anterior, and because it's a BruxZir, we can have minimal reduction in order to fabricate these crowns. You want to go ahead and check the bite, and like I said before, the reduction guide is seated on top of the teeth to make sure that you do have enough reduction. One little trick is that you can always place a hole through the different areas of the reduction guide, and using your periodontal probe, you can check to see how much reduction you have through the actual reduction guide. So once we know we have enough reduction, we can go ahead and reline our biotemps, and the patient can actually go home with a set of temporaries. When the patient comes back to have the final impression visit, if you don't do it at the same day of the prep, the biotemps are removed. What I like to use, and what Dr. Mirsan used in this video, is a ultrasonic to get rid of the temporary cement. It's very helpful, so you don't have to scrape away at the temporary cement. And then the two-core technique is utilized so that we can go ahead and capture the margins. So once the first cord is placed, we'll go ahead and refine our margins and make sure that we have nice, clean, visible margins. And then the second cord is placed along with some cotton rolls or comper caps. I really like using these comper caps because the pressure on the tissue helps the retraction and also helps with the hemostasis around those teeth. So after a period of 3 to 4 minutes, we can go ahead and remove that second cord that was placed and inject the light body and the medium body, or actually in this scenario, this is medium body capture material along with heavy body capture impression material. So once the impression material is set, we can go ahead and remove the impression tray from the patient's mouth, and we can visualize the margins that are captured within the impression. And utilizing a triple tray, I believe this is a clinician's choice triple tray, and I like these because they're very rigid. You can go ahead and capture the area where you want to impress. One important aspect of the BruxZir Anterior is that there is a bit of translucency in this restoration, and it's very important to capture the stump shade and relay that information to the dental technician so that they know what they're working with underneath the final restoration. So once the stump shade is selected, the information is sent to the laboratory, and the technician can design and produce a BruxZir Anterior restoration. And as you can see here, they are very well integrated into the patient's mouth. So I'm very excited about this product. It's a very good product, and it brings a little more translucency to the original BruxZir line of restorations, and I hope that you get a chance to use it in the near future.
Thank you for that, Dr. Abai.
Thank you, Megan. Did you like it?
I did. It was awesome.
Oh, thanks.
And now let's go to a segment we call Viewer Mail. This week's viewer mail comes to us from Dr. Hugo Schmidt, and he's from Green Bay, California, which born and raised California here, and I don't know where that is, so I need to Google it when we're done with this. But he writes in and says, how is BruxZir now a new product? Is it that you haven't been able to mill BruxZir Chairside previously?
So thank you for your letter, Dr. Schmidt. I want to address this in terms of BruxZir being not a new product. However, what we've done is we have sintered the BruxZir material beforehand. So we've sintered it, we've placed it in these smaller blocks, and we can use it with the TS150, and we can mill it chairside. This gives us the advantage of not having to place it in the oven for sintering after it's done milling. So we can go ahead and take it out of the mill and polish it and deliver it directly into the patient's mouth. Megan, we got our first viewer mail.
We did. We got through it, and I Googled it, and Dr. Schmidt is from Green Bay. Like I had said, I had no idea where it's from, but it's actually in the Bay Area, north of San Francisco.
That's great. Well, yeah. What do we have in the news, Megan?
Well, let's check it out. A Texas dentist is accused of obtaining drugs through her dental practice, but not for what you probably imagine. According to an arrest warrant, the woman gave the heavy drugs to her personal livestock. She had been ordering an excessive amount of hydrocodone. Turns out she would have had to give out about 85 tablets to patients each day of the week over the entire year. She admitted to taking the tablets home, where she gave it to her horses and cows for pain management. Apparently, the woman's husband works at the dental office and told police he was not happy with the treatment his animals were receiving from their vet. He said he had been taking the drugs from his wife's clinic for about 3 years. The woman is charged with diversion of controlled substances.
Those are some lucky animals,
aren't they? Honestly, what kind of issues are these animals having if they're on like heavy drugs for 3 years?
You know, it reminds me of the trophy animals. They just want pills.
It's so bad. Oh.
Well, do you have anything else in the news? I mean, that's so interesting.
I know. Well, how can we top it? Let's see. A Massachusetts woman was arrested at a mall last weekend for allegedly shoplifting and assaulting an employee with her teeth. Police say an officer arrived at the JCPenney after receiving a report that the store's loss prevention officers were struggling with a shoplifter. An employee told the officer that he was injured and showed 2 bite marks from his struggle with the suspect. The 38-year-old woman allegedly shoplifted 2 bottles of designer perfume. This is her 3rd shoplifting offense, according to the report. The woman was charged with shoplifting and assault and battery with a dangerous weapon, her teeth.
Do you think the teeth were actually in her mouth when she assaulted with them, or did she take them out and assaulted?
Not in this case. She had her teeth and she was ready to use them.
Well, she's 38, and
right.
Depending on what part of Massachusetts she's from, that will determine whether the teeth stayed in the mouth or not.
Don't take offense to that, all my Massachusettsers.
No, I love Massachusetts. I went to school there.
Oh, nice.
Anyways, that wraps it up for this week,
Megan.
Thank you for joining us for this episode of Chairside Live, and we will see you next week.
Come back.
Like stomach sleeper.
Yep.
But then sometimes I'll wake up and my arm is like this.
Oh, no.
And I'm like tapping out and I have to like,
right,
I'm like choking myself out. Yeah, it's crazy.
Is it that you haven't been able to brill or mill? It's whatever you choose. Bada bing, bada boo! Hey everybody, we got a great show for you tonight. Thank you for that, Dr. Abai.
Thank you.
Now let's go to, I went to this camera. Don't take offense to that, all my Massachusettsers.